there is displacement of frontal process zygomatic bone, and there is separation at the frontal zygomatic suture. Look here, and also at infoorbital and coming down towards the zygomaticomaxillary buttress region. Here is also separation sign and step deformity over there. If you compare this maxillary sinus with the left side of this normal, this is a normal pyramid shaped sinus, and this buttress region is properly contoured on this radiograph. But here on the right side, if you come from here, and there is step over there, and there's disruption, there's discontinuity, and also there is fracture line in the zygomatic arch. That is where this body of zygomatic bone is joining with the zygomatic arch. There is separation sign over there, and also at lateral orbital margin and infoorbital arch, which signifies right zygomatic bone fracture. Here, but here it is a tetrapod fracture. Body of zygomatic bone is intact, but it gets fractured from its associated sutures. Okay, and this is a PNS view of a patient with panfacial fracture. There is frontal sinus fracture, nasopharyngeal fracture over there, and right-sided zygomatic bone get displaced grossly at the lateral orbital margin. Also at infoorbital margin, there is fracture line over there. The sinus is hazy on this side also. You can't compare in this case because on the left side also sinus is hazy. And this, if you take an imaginary orbit, there is disruption at the lateral orbital rim, at frontal zygomatic suture, and then also at some lower area. That is, this fracture segment is in between. There are two fracture of the lateral orbital wall over there, and this zygomatic bone gets displaced downward and laterally. It has increased the overall orbital volume over there. And in these situations, there could be hypoglobus, there could be diplopia, there could be anophthalmosis over there, and there is haziness of sinus. No proper contour of the zygomaticomaxillary buttress region is there. Coronary process, the zygomatic bone is directly impinging on the coronary process on both sides, and due to which this patient could have limited mouth opening also. And the mandible is also fractured, but not so appreciated on the PNS view, because the ideal radiograph for mandible are the OPG and the PNS. Okay, one other recommended radiograph for zygomaticomaxillary complex fractures is the submental vertex. This is a submental vertex view, also called jug handle view, because when you visualize this, this is a normal arch on the left side. I'm discussing this left sided radiograph at the moment. And left-sided radiograph and its left side. This arch, this is properly shaped normal arch. And when you visualize this from below this radiograph, this arch is in the shape of a jug handle. That's why it's also labeled as jug handle view. And here is the triple fracture on this right side of this, in the right-sided picture, on the right side where I'm moving this cursor. This is triple fracture. This is how it presents on the radiograph, that when there's a blow from outside, the arch gets displaced medially towards the infratemporal or temporal fossa, and here is the fracture in the mid, and here is the fracture anteriorly, and here is the fracture posteriorly. Triple fracture, 3 fractures. And when there's a blow, the arch will come medially. Once the arch will come medially, it is V-type in fracture. We have discussed in the classification. And this is the post-op radiograph of the same patient. This arch was just elevated with the Gillies approach. They were one of the treatment options, conservative option for the zygomatic arch management. And this is the post-op radiograph. Now the arch is in its normal location. Here is the slight fracture which will get remodeled in future, and that will get healed properly. And this is the whole management point. Okay, then the gold standard is the CT scan for complex injury, and these are the axial views of CT scan. There are mainly 3 views. One is the axial, the other one coronal, the third one sagittal view. And you have a clear understanding of these views. Axial view, first listen, any view parallel to floor, one definition. Any view parallel to floor is the axial view. The other definition, if you cut the body in equal to upper and lower halves, then this plane is the cutting plane, is the axial plane. And any plane parallel to this is also axial plane. And looking these 2 views of CT scan, these are the views in which the area of skull has been cut down, like these are just like the areas are cut down at the level of zygomatic bone, and we are visualizing either from below or from above. And this is the bone window, and this is soft window. We will discuss. First, I have to define the views. Axial view, that is horizontal view. Parallel to floor are cutting the body in two equal upper and lower halves, and any plane parallel to this also an axial plane. Then, or you can say a plane parallel, third definition, plane parallel to occlusal plane, parallel to occlusal plane. And then the other, for coronal plane, if you cut the body into two equal halves, anterior and posterior, in axial plane, upper and lower, in coronal plane, anterior and posterior. If you cut the body into two halves, anterior and posterior, this plane is the coronal plane. And any plane parallel to this is also a coronal plane. And it is exactly what you say, that PA mandible. When you visualize from front, it is parallel to the PA mandible, or parallel to coronal suture. Another definition, a plane parallel to coronal suture. And then sagittal plane. Sagittal or mid-sagittal plane. If you divide the body into two equal right and left halves, in the first one, upper and lower, then anterior posterior, and in case of sagittal, if you divide the body into two equal right and left halves, then the plane is called mid-sagittal plane. And any plane parallel to this plane is also a sagittal plane or parasagittal plane. And this is exact. The other definition could be a plane parallel to the sagittal suture. The third definition could be plane parallel to midline, or a view in just similar to the lateral view. Lateral view. These are three planes, and when you reconstruct these planes, we get a three-dimensional reconstruction of face. This is just like you are directly visualizing the scan, the skeleton of the face on a film. We will see in the coming slides also. Okay, now coming towards this slide, the axial plane. This is on bone window, and on the right side where I'm moving the cursor, and on the left side it is on the soft tissue window. How we can differentiate? On the bone window, like here in the right side, in the malleol region or zygomatic. This is zygomatic bone. Okay, I'll just slightly describe the anatomy also so that the beginners can understand properly. This is lateral wall of nose. This one, lateral wall of nose. This is the nasal septum or mid of the nose. And clearly here is the tip of the nose. These are the lateral aspect of the dorsum of the nose. Here is the nasal septum. And on the sides, these are the nasal cavities, because this section is at some superior level. That's why the nose is not, the nasal cavities are not so broad. And posteriorly, this is the posterior nares over there. And this is nasopharynx posteriorly. And this is the lateral. Window. On bone window, we can see the bone prominently. Prominently means you can appreciate the outer cortex of the bone, the inner cortex of the bone, and in between the medullary bone also. Like here, cancellous bone, the cortical bone and cancellous bone. Like here in case of the vertebrae also, there you can appreciate. But this other picture is of the soft tissue window, where the bone is there, but you can't differentiate between cortical and cancellous bone. But the whole radiopaque area of the bone is there, and the soft tissue is prominent in this. And on this axial view, the right side, if you compare both right and left side, on the left side of this peak, the zygomatic bone is intact, but on the right side, there is damage to the zygomatic bone, especially at its anterolateral wall and posterior lateral wall. And the overall size of the medullary sinus has decreased due to damage to the zygomatic bone. Okay, this is a coronal view. This is a coronal view. And I have clearly described the coronal view. I will just now describe the fractured areas on these views. On the right side sided picture, on the right side of this peak, there is damage to the anterolateral wall of medullary sinus. There is, where I'm moving this yellow cursor, the body of zygomatic bone and lateral aspect also, and also orbital floor. Look here, this orbital floor has get damaged and it has come down towards the medullary sinus. Okay, one more thing. There is a sign called, I have not discussed in the clinical features or radiographic. We have the radiographic feature. I will discuss it. There is a sign known as teardrop opacity or hanging drop opacity when there is zygomaticomaxillary complex fracture, or especially when there is orbital floor fracture and blowout fracture. Once the floor fracture is there and the floor has come down towards the medullary sinus, the contents of the globe of the orbit, they will come down from that fractured area downwards towards the medullary sinus. And on the PNS view especially, if the contents are there, within the medullary sinus, you will find a small opacity over here called as hanging drop opacity or teardrop opacity. It's also one of the significant features of zygomatic complex fracture. And here on this this soft tissue window also on picture on the sorry, this in this pic, the left sided is the bone window and on the right side is the soft tissue window. And there is damage to the zygomatic region also. And if you compare the sinuses on the left side and on the right side, in this right-sided picture, this left-sided sinus is properly formed, normal, and in normal contour zygomatic buttress region, zygomatic bone in orbital margin, as or you can say that this floor of orbit or roof of the sinus and lateral orbital wall. This is the ostium of sinus. This is the ostium sinus. Once the sinus is filled with the blood after trauma, the blood from this ostium will go into the nasal cavity, which will appear as epistaxis. But on the right side, there is fracture, disruption of the floor, anterolateral wall of medullary sinus also, and lateral wall of the medullary sinus, and also of the orbit and the body of zygoma also. And also appreciated on this bone window also. If you compare on bone window the right hand side, left-sided and left-sided medullary sinuses, the left-sided sinus is normal, but on the left side, the left-sided sinus is normal, but on the right side the sinus is it has decreased size because this bone has get disrupted towards the medullary sinus. Okay, then in this pic, the axial views as well as the coronal view are on the same slide. So that you can have a better idea of this. Look here on this axial view, there is damage to the and this is on the soft tissue window, because this whole bone is radiopaque, but the soft tissue. Look here, this is the lateral pterygoid muscle going from condyle towards the pterygoid plates, and this is the coronoid, this is the condyle, and near the coronoid there is masseter as well as there is the temporalis muscle also. And the body of zygoma here, the body of zygoma has get displaced towards the sinus, and clearly visible on the axial view. Like here there is step deformity over there, and in this axial view there is damage to the zygomatic arch, typical V-type infraction again here on the mid pic on the right side where I am moving this cursor. Look here now, V-type infraction, and on this coronal view also there is damage to the zygomaticomaxillary complex. On the right side of this pic, the sinus is normal, the zygomatic bone is normal, orbit is normal, but on the left side there is damage to the zygomatic bone, and the bone has moved inward and posteriorly into the medullary sinus, decreasing the overall size of the sinus. This is 3D reconstruction of face. A very, very excellent imaging technique for assessing the facial skeleton. Here directly you can visualize the overall facial skeleton, like that you are directly visualizing the facial skeleton. And there is if you you can appreciate on the in the right side of the picture, on the right side, look here, there is step at the infoorbital margin, at the zygomaticomaxillary buttress area, and this whole body of zygoma has get fractured again in the body again, and other fracture over there, and going posteriorly at the junction of body of zygoma with the zygomatic arch, there is fracture, and this arch has gone outward. Why it has come outward? There could be some fracture more posteriorly over there also, and there is fracture at the frontozygomatic suture. This is frontozygomatic suture, and there is the fracture, and fracture of the this at the junction of this lateral wall with the body of zygomatic bone. Again, there is also another fracture, and this all these fractures has led to the outward and lateral displacement of the whole zygomatic bone, as well as the lateral orbital wall also, and floor of orbit, which has increased the orbital volume. If you see the contours of the contralateral normal orbit, it is normal. The zygomatic bone is also in its normal place, but here in the right side, the bone has get displaced. The overall volume of the orbit has increased. The same patient from the lateral aspect, you can appreciate zygomatic arch fracture, which I was describing here, that there could be some posterior fracture also. Look here on the arch, there is triple fracture of the arch and comminuted fracture of the body of zygomatic bone over there. But at frontozygomatic suture, look here, then the lateral orbital rim and wall are fractured, body of zygoma, multiple pieces, multiple comminuted fracture. And then coming towards the arch at the junction of body and the arch, there is a fracture, and triple fracture of the arch is also there. Look here, once the fracture is like this and it has come out and down, it is directly impinging on the coronary process. Look here, and that is why such patient, if tries to open the mouth, there will be limited mouth opening. Okay, along with these fractures of zygomaticomaxillary complex, there is also maxillary fracture in this 3D CT scan. And if you can appreciate, there is paramedian split on the contralateral. Contralateral means opposite side, other side, between the central incisor and the lateral incisor. There is separation over there, where I'm moving this cursor. And this maxillary segment, it has dropped down, and posterior teeth has just are in contact, and really gets open wide. Once the posterior teeth only are in contact, this is called gagging of teeth. This gagging of posterior teeth is a feature of Leaford 1 fracture, Leaford 2 fracture, and Leaford 3 fracture, but not in case of isolated zygomatic bone fracture. Due to this gagging of posterior teeth, there could be difficulty in chewing and mastication also, or there could be pain and tenderness on occluding the teeth also. And due to impingement of coronary process, there could be limited mouth opening also. And due to this fracture, Leaford fracture also, there is deranged occlusion. Listen carefully, that in case of isolated zygomatic bone fracture, rarely the occlusion will be disturbed. But once the fracture is also has involved the bones bearing the teeth, like maxilla or the mandible. Once these bones get fractured, there will be disruption of the occlusion, this rearrangement of occlusion. Like in case of midfacial fracture, when there is Leaford 1 fracture, Leaford 2 fracture, Leaford 3 fracture, or zygomatic bone fracture along with some atypical maxillary fracture, then there will be derangement of occlusion. And in case of almost all type of mandibular fractures, there could be derangement of occlusion. Then again, the 3D CT scan of another patient, here in the most right-sided picture, upper left-side picture in the slide. This one, the normal side, right-sided bone is normal. On the left side, the body of zygomatic bone, it has get fractured, and zygomatic arch has get fractured at the junction of body and the arch. There is also a fracture. And from the lateral aspect of 3D CT scan, you can more appreciate this. There's a fracture at frontozygomatic suture, fracture at the junction of body of zygoma with the zygomatic arch, and arch itself is also fractured, but it is displaced medially, but not superior inferiorly. If the arch is medially displaced, we can bring it out with Gillies approach only, with conservative approach. And here also, if zygomatic bone fracture is displaced inward and medially, it can be elevated with conservative approaches also. But if the zygomatic bone is there's 4-point disarticulation of the bone, or if there's outward displacement, or if there are comminuted fractures, or if there's some existing laceration present, or if some foreign body invasion is there, then these are the indications for open reduction and internal fixation of zygomatic bone fracture. You can also appreciate the zygomatic bone fracture as well as arch fracture at all articulations of the zygomatic bone, that is frontozygomatic suture and the suture of arch with zygomaticotemporal suture within the arch, which is the suture which is formed with the by the temporal process of zygomatic bone and the zygomatic process of temporal bone, and also at zygomaticomaxillary suture here at infraorbital margin, as well as also at the zygomaticomaxillary buttress region. Sorry. Okay, now we're going from simple fractures towards the more complicated cases or complicated fractures. Here in this 3D reconstruction scan, almost whole midfacial area is comminuted. The zygomatic fractures, these could be isolated fractures. Then there could be damage to the adjoining bone of the zygomatic bone, which is called the zygomaticomaxillary complex fracture. Or there could be multiple fracture. There could be associated fractures, like zygomatic bone may be fractured isolatedly or with other fractures also. Like here in this scan, there is this low level Leaford 1 fracture. There is Leaford 2 fracture also, and there is zygomatic bone fracture. Relatively, the body of zygoma, there are fracture lines, but these are simple cracks or undisplaced fractures. And there is slight displacement at frontozygomatic suture also. I'll point out with this colored pointer. At the frontozygomatic suture also. Then suborbital rim fracture, or you can say that this frontal bone fracture, or also we can label it as frontal bone fracture, or frontal sinus fracture, or outer table fracture of the frontal bone, or suborbital rim fracture. And here this is nasoethmoidal fracture. Naso-orbito-ethmoidal fracture, medial wall of orbit fracture. This is the frontal process of maxilla, which articulates with the nasal bone as well as also with the frontal bone, and more with the frontal bone, at frontonasal suture and at nasomaxillary suture. This is also disrupted, and here is also infraorbital disruption at infraorbital margin. There are multiple fractures in this, but relatively less fractures on the other side of the scan. Scan of another patient, again zygomatic bone fracture you can appreciate over there at lateral orbital margin, at frontozygomatic suture, at infraorbital margin, as well as zygomatic buttress region, and here in the Leaford 1 level also, at Leaford 2 level also, but the arch is relatively intact. And here in this scan, there is fracture at the infraorbital margin, at the body of zygoma, at anterolateral wall of maxillary sinus, or at the junction of body of zygoma with the maxilla at Leaford 1 level. And also this is a nasal aperture, and Leaford 1 fracture, it just starts from the piriform aperture of nose. Look here, this is typical line of Leaford 1 fracture. And if fracture is coming from infraorbital margin towards the zygomaticomaxillary buttress region, and over above here in the frontonasal region also, and same on the contralateral side, then it will be Leaford 2 fracture. This is atypical zygomatic bone fracture. This is not typical fracture in this on these things. Usually, what we have seen in the previous slides, that the zygomatic bone gets fractured from its articulations. Articulation means from its sutures with the other bones. But here in this scan, in this 3D evaluation, here frontozygomatic suture is intact. Some portion of body of upper portion of body is intact. Whole arch is intact. But the fracture line is going through the body of zygoma. Usually, this type of fracture is not there. But commonly tripod mallar fracture, tetrapod mallar fracture, that is the zygomatic bone fracture. From its different articulations, it gets fractured. But this is atypical fracture going mainly through the body of zygomatic bone. If you visualize this on the inforbital margin, there is step deformity, and the fracture has gone posteriorly in the sagittal plane, from anterior to posterior, through the body of zygomatic bone. Again, look here at the buttress area. There is not too much disruption. There is only anterior to posterior body of zygomatic bone fracture, and separating this body from the zygomatic arch. Usually, the body of zygomatic bone separates, what we have seen in the previous slides. The body of zygomatic bone, it gets separated from the arch at its junction, but here it is in the sagittal plane, from anterior to posterior. And 3D scan of another patient. There again, it's also an atypical fracture. Fracture through the body of zygomatic bone and lateral aspect of inforbital margin, and at the junction of arch with the body of zygoma. But frontal zygomatic suture is intact. And there is fracture at the inforbital margin also, along the middle sinus also, here at the nasal aperture also, at the junction of frontal process with the frontal process of maxilla with the frontal bone also, and at zygomaticomaxillary buttress region also. And here, look here, once the bone has gone inward as well as downward, it is in contact with the coronoid process. And once it is in contact with the coronoid process, then it impinges on the coronoid process and it leads to limitation of mouth opening also. Same from the frontal view, the scan of the patient. Here, there is fracture of inforbital and buttress region also, as well as junction of the body with the lateral orbital wall and also with the arch. Multiple fracture of the zygomatic complex. Okay, more complex cases here. There's a 3D reconstruction of the patient with almost whole mid-facial fractures. Whole mid-facial area get fractured, but there is gross displacement of bilateral zygomatic bones. Previously, what we have seen, these were unilateral fractures of zygomatic bone, and the displacement was relatively not so great. And there was single fracture, multiple fractures, but displaced and undisplaced comminuted fractures, but not gross displacement. But in these scans, you can appreciate gross displacement of the zygomatic bones bilaterally. Look here at frontal zygomatic suture. This gross disruption gap, almost 1 centimeter gap between the zygomatic process of frontal bone and the frontal process of zygomatic bone. There is gross displacement, and it is bilaterally. And the zygomatic bones bilaterally, they have come down, and they have led to the increased orbital volume. Moreover, there is also associated naso-orbitoethmoidal fracture. There is also Leaford 2 fracture and also Leaford 1 fracture. But fortunately, at Leaford 1 level and at Leaford 2 level, the displacement is not so great. There's minimal displacement. And this patient has some loss of dentition, not due to trauma previously, and due to certain other reason. They are a partially dentate patient, and with some anterior dentition, and due to less displacement at Leaford 1 level and 2 level, there is derangement of occlusion, but not of so there's minimal derangement of the occlusion over here. But there is gross displacement of zygomaticomaxillary complexes bilaterally in this patient in the 3D scan. And this is a scan of a patient with panfacial fractures. As I have said, that a fracture, if it involves the upper third, middle third, and lower third of the face, we will label it as panfacial fracture. There is a frontal bone fracture from the upper face, nasoethmoidal fracture over there, and then bilaterally frontal zygomatic suture here and here. We have seen previously the pre-PNS view of this patient also, where there were 2 fractures on the left side lateral orbital wall also. Here, disruption at frontal zygomatic suture, and also at the junction of body of zygomatic bone with the lateral orbital wall, where I am pointing this yellow cursor. And there also there's something at inforbital margin, orbital floor, and also at LeFO2 level, and also at LeFO1 level, and especially at LeFO3 level also. And there are also on the right side, inforbital margin is disrupted, fractured, and zygomatic complex is also fractured, and fractured at LeFO1 level also. And here in the maxilla, the fracture is going down in the occlusion also, in between lateral incisor and the canine on left side, and posteriorly in the premolars or molar region also in the right side, leading to the fracture of this maxilla also, with two paramedian splits also, leading to a three-piece maxilla. And in the lower face over there, there's gross displacement of bilateral condyles. The condyles has moved outward. This is bilateral dislocation of the condyles, bilateral lateral dislocation of both of the condyles due to fracture of the mandible also. And there's fracture on right side, and this case was referred to me over there, and was treated in periphery by some general surgeon or someone else, and there's maltreatment of this case. Only mandible was treated with the large bulky plates, not with the mini plates. And we have redone all this these fractures. Then we'll see in the coming slides also. And again, I will repeat, there are multiple mandibular fractures, midfacial fractures, as well as upper face fracture. Mandibular right parasymphysis fracture, left angle fracture, and bilateral lateral dislocation of both of the mandibular condyles. And there's LeFO1 fracture. Then there is a LeFO2 fracture also. And then bilateral zygomatic bone fractures, LeFO3 fracture, as well as lateral orbital rim fracture, orbital floor fracture, as well as nasoethmoidal fracture, and frontal bone fracture also. Then we can label this fracture as panfacial fracture. Okay, what are different treatment options for coming after diagnosis towards the treatment option? There are different treatment options. There are conservative options. Conservative mean these are